When we're using robotics to do knee replacement, the first thing we have to do is put sensors or trackers in the joints. So we put them up top on the femur bone and down below on the shin bone or the tibia bone. Then once those are in place, the approach to the knee really doesn't change. We still do a minimally invasive approach to get to the knee and access the knee. Once we have access, then we use different tools to validate that what we put in the robotic computer before surgery is the same as what we're seeing in surgery. And once we validate that, then the robotic arm will come in. And with the robotic arm, we can use that to make our cuts. So we make all of our cuts. But before we do that, we have a screen that we can use. And when we look at the screen, it will give us all of the different measurements. So we can stress the knee and we can see what type of laxity we have in the ligaments throughout the whole arc of motion. And then we can make changes to our plan based on what we're seeing intraoperatively.